Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide the Public Health Weekly Update with data accurate as of September 15th, 2022. This week, I'm going to do a quick update on three topics that we've been talking about in the last few weeks and months. Is COVID-19 coming to an end? Why aren't we hearing more about monkeypox? And what's going on with polio in New York? So is COVID-19 coming to an end? Many of you saw the headline where the head of the World Health Organization said the end of the pandemic is in sight. The data that they said is as the weekly numbers of reported deaths is the lowest it's been since March 2020, that the end of the pandemic is now in sight. And if you look at deaths over time globally, you can see that, yes, indeed, we are at the level that we were in March of 2020 when the pandemic began. What I find a little bit strange, though, is we've been there for about 4 months. In fact, it's gone down. It's been lower than it is now. It's been a little bit higher. So I don't know that I see a particular reason today to say that we're any closer to the end of the pandemic than we were a couple of weeks ago. That's not to say it's not coming, but I don't see the signs that definitively say that. To date, 6.5 million official deaths and still about 1,500 deaths a day. So certainly not anything to walk away from at this point. We see the same pattern in deaths in the United States. We've seen actually about 5 months now, pretty much a steady number of deaths, a little over 1 million total deaths, and still running 300 to 320 or so deaths a day. So is the pandemic coming to an end? I would say it has stabilized. We don't know for sure what the future is going to hold. It's particularly concerning because if you look in September, each of the last 2 years, there was 1 year where September was a trough, 1 year where September was a peak, and now we're sort of at this flat area. What none of us know is what's going to happen next. But I think the pattern that we're seeing globally and the pattern that we're seeing in the United States is more consistent with we are reaching a steady state pattern rather than we're coming to the end. In terms of where the cases are in the United States, we continue to see this cluster in central Appalachia and no other real hotspots anywhere. So is it coming to an end? I hope so. Does the data tell me that? No, the data tells me that we're sort of getting into a chronic state. Maybe, some have called it the new normal. I don't know that that's accurate, but again, I don't see it coming to an end, at least in the short term. Second question, why aren't we hearing about monkeypox? A few months ago, we were hearing a lot about it. Well, it hasn't gone away either. Almost 60,000 cases worldwide in 100 countries, and the vast majority of them, 99%, are in countries that have had no historical monkeypox. The number of deaths has been slowly creeping up, with 19 total deaths and 9 in countries that have not historically had monkeypox. For those of you who haven't seen this map before, the blue dots there in Central and Western Africa are where monkeypox has historically been, or at least been recognized since the 1970s. All of the other dots are in countries that have not historically had monkeypox as an endemic disease. There was a monkeypox outbreak in the United States about 2 decades ago, but again, it was very specifically associated with the importation of small mammals from West Africa. In the United States, we've had about a third of all the cases, actually a little over a third of all the cases in the world, and 1 death. In terms of the daily reporting, as we've looked at this before, the numbers every day go up and down. So I've sort of added it up by week, and this is what we were following. We saw this increase over time, and now it's been coming back down. So, but again, we're still running 250 or so cases a day. So why are we not hearing about monkeypox? I think it's just because other news items have crept in, Ukraine, the death of Queen Elizabeth II, and so on. But monkeypox has not gone away. It is coming down, but it is not coming down as quickly in the States as it has in other countries. So we'll keep our eye on that. And finally, what's going on with polio in New York? The headline, New York declares a state of emergency over polio. I don't normally recommend and link to news articles. I prefer to link to official sites, CDC, WHO, but this was a particularly good article if you really want to read about what's going on with polio virus. Science News recently had this link. And basically, the background is there was a case of paralytic polio. A young man developed paralysis in New York with the strain of the virus that's associated with the oral vaccine, which is given in other countries. Following that, the state tested wastewater looking for the virus and found it in several counties and in New York City. Just as a reminder, there are two types of polio vaccines, not virus. There's an injected and inactivated vaccine and an oral or attenuated vaccine. The only one that's been used in the United States in the last 2 decades is the injection, the inactivated. It's a dead virus. The attenuated means it's a live virus, but has been modified in such a way that it normally doesn't cause disease. It is still in use in a number of countries because of the way that it spreads. It can help provide some level of community protection. Unfortunately, over time, the oral, the attenuated vaccine can evolve and rarely can cause disease as it did in New York. Now, typically, of course, if you're vaccinated, you're not going to get this disease. But if you're unvaccinated or in a community with a high unvaccinated rate, it may happen. So there's only been one case of paralytic polio in New York, at least reported as of today. And so does that mean people are generally safe? And the answer is no. Well over 99% of infections with the polio virus do not result in paralysis. So this means the virus can be spreading widely and not causing obvious disease. As the article says, low immunization rates mean that vaccine-derived viruses can spread largely among unvaccinated people and circulate silently before someone gets sick. So that's why New York has declared a state of emergency. And they say if your child is unvaccinated or not up to date, the risk of paralytic disease is real. Polio immunization is safe and effective, protecting nearly all people against disease. So the advice is, yes, as long as there is any type of polio virus spreading, including the vaccine-derived virus, there is a risk to folks. In terms of vaccination rates, the U.S. rank on average is about 93% of kindergarten kids are vaccinated, from a low in Idaho of 86% to a high in Mississippi of 99%. So we need to get as many people vaccinated as possible. Many of us are vaccinated or old enough to have been around before. So is COVID-19 coming to an end? I don't see the information to suggest that it is. It looks like it's becoming a chronic, relatively stable disease. That could change by next week, and if it does, I'll let you know. Why are we hearing about monkeypox? Well, it's still out there. It's still causing disease. Fortunately, it's not causing a lot of death. And what's going on with polio in New York is that a vaccine-derived version of the virus appears to be spreading in the wastewater, though we haven't seen much disease from it. So a great deal more information on the College of Public Health website. If you know of anyone who would like to be added to our mailing list, please let me know. Thanks as always to Dara Young for editing, producing, adding captions, and posting this video. And importantly, if you have any questions about COVID, about monkeypox, about polio, about global climate change, about gun violence, any of the evolving issues, I'd be happy to provide you an answer either by return email or in an upcoming weekly video. So until next week, please be well.